I recently had a very good example of why people do not speak out about their mental health. It related to an employee in the workplace where a lot of mistakes were happening and a lot of customer complaints were following. The manager then took it upon himself to write a series of tests for his staff in order to test their product knowledge so that those mistakes wouldn't happen. Well, one employee went into a complete decline and actually stayed away from work and didn't message his manager, went offline, didn't answer his phone, and when he came back the next day, told an obvious lie about why he was absent. In most organizations, that would really get you into trouble. He could not tell his manager that the reason why he was taking off was the test that was coming. Absolutely terrified. And the language around the taking of the test felt to the employee like if he wasn't going to pass it, he would be fired, which wasn't the intention of the manager at all. So there was a communication issue from both sides. If the manager had lacked empathy, he would have taken the employee to task for his absenteeism. Instead, what he did is he acknowledged that something must have gone wrong. So he approached the employee and asked him, didn't confront him about the absenteeism, but asked him, what was wrong? Are you okay? Which is a question we don't ask employees enough. And the employee then confessed that he was absolutely terrified about the test. Because of the manager's empathy, this worked out really well. He was able to reassure the person that the intention was never to fire the person, but to make sure that there was product knowledge. The employee then was reassured, studied, passed the test with 85% and knows the product better. Had he, however, stubbed his toe and broken his toe, he would have simply gone to the doctor, told his manager he's going to the doctor, and nobody would have thought anything of it. But to tell somebody that you're suffering from anxiety cancels you. Most managers don't know how to deal with that information. In fact, most of us don't know how to deal with that information. So we kind of write people off when they tell us that they're anxious, and we kind of think it's a permanent problem, never to be fixed. Whereas mental health should be treated like any other health issue. Go to the doctor, you put a plaster on, and you fix it. This turned out well, but it could have been very much worse had the manager lacked the necessary empathy to discuss this in the proper way. So let's have a discussion on mental health, anxiety, and with a focus on bullying and harassment.